If you're a health science student and it seems like pharmacology, pharmacy, and therapeutics all mean the same thing, you are not alone. Most of them mix them up, and that confusion usually shows up later in exams. In this video, we will clear that confusion once and for all by breaking down what each term really means, how they relate, and why separating them will make pharmacology feel far more organized. Now let's talk about why this confusion exists. Students often use these words interchangeably. You will hear things like, I'm studying pharmacy, so I'm doing pharmacology. Therapeutic is just drugs. Pharmacology is about dispensing. That confusion is understandable because these fields overlap. But overlap does not mean they are the same. You can't apply something properly if you don't first understand how it works. That is where separation begins. Now let's think about this bigger picture. Think of it this way. Before you drive a car, you need to understand the rules. You need to know how the car works. You need to know when and where to apply those rules. Drug science works the same way. Pharmacology explains the rules. Pharmacy handles the practice. Therapeutics apply drugs to treat diseases. Same drugs, but different rules. Pharmacology is the science of how drug interacts with the body. It answers questions like, what does this drug do? How does it work? Why does it cause side effects? Why does the dose matter? Pharmacology focuses on mechanism of action, drug receptor interactions, physiological effects, and the adverse effects. It does not focus on dispensing, packaging, or selling drugs. For example, why does propranolol reduce heart rate? Why does morphine relieve pain but depresses respiration? Why does adrenaline increase heart rate and blood pressure? Those answers come from pharmacology. And a mnemonic that can be used to help is that pharmacology equals to the principle of drug action. If you understand pharmacology, you can often predict what a new drug might do even before memorizing it. Now we are going into pharmacy. Pharmacy is about the preparation and supply of drugs. It deals with formulation, compounding, storage, dispensing, drug quality and safety. Pharmacy answers questions like, is this drug stable? Is this the correct dosage form? How should it be stored? How should it be given to the patient? Pharmacy is practice focused. It relies on pharmacology, but it is not the same thing. A mnemonic for pharmacy is that pharmacy equals product and practice. Now let's talk about therapeutics. Therapeutic is where everything comes together. We'll be talking about therapeutics now. Therapeutic is where everything comes together. It is the use of drugs to treat disease. Therapeutic answers, which drug is best for this condition? When should treatment start? When should it stop? And what alternatives are available? Examples include choosing ACE inhibitors for hypertension, using insulin for diabetes, selecting antibiotics based on infection type. Therapeutic depends on pharmacology to understand drug effects and pharmacy to ensure correct preparation and delivery. The mnemonic for this therapeutic is equals to treatment decision. Putting it all together, let's use one simple drug, paracetamol. Pharmacology explains how it reduces pain and fever. Pharmacy ensures it's safely formulated as tablet or syrup. While therapeutics decide when to use it, at what dose, and in which patient. Same drug, three different perspectives. I'm going to give you a master memory tip now to remember pharmacology, pharmacy, and therapeutics. Pharmacology is equals to principle, pharmacy is equals to practice, and therapeutic is equals to treatment. If you remember PPT, you won't be confused again. And why this matters for your course? In this course, we focus mainly on pharmacology and why it connects to therapeutics. and why it is referenced to pharmacy when necessary. Real healthcare blends them together, but learning works better if they are separated first. You need to first understand the rules, then apply them. So whenever you hear these terms, remember pharmacology explains, pharmacy prepares, and therapeutic applies. Once this foundation is clear, everything else in pharmacology becomes easier. If you found this useful, don't forget to like and subscribe. Tell me in the comments which topic you would like to see next.